Hello, we're answering questions on sexual health. I'm joined by Dr. Catherine Hood. Hello, Catherine.
Hello.
Got a question here from a 55-year-old woman who says she's still active, sexually active with her husband, but she's been experiencing reduced sensitivity during sex, and she wants to know if there's anything she can do to stop this from getting worse. I wondered what she meant by reduced sensitivity.
Yeah, it can mean various things, can't it? I mean, I think given her age, she's 55, the chances are she's either around the age of the menopause or she's already gone through the menopause. And there are several things that can happen around that time and several things that can happen just with ageing. I think the first thing is the pelvis has a muscle in it that goes from front to back. It's called the pubococcygeus, or the pelvic floor muscle. Now, most women will be aware of this who've had children because they're told to exercise it like mad afterwards. But,
and we never do it as much as we should.
Exactly. And this can mean that as you get older, that muscle gets a little bit flabby and a little bit lax. Now, the thing is that the vagina goes through that muscle. And so if the muscle gets really lax, it means that the vaginal tone goes down and you can't feel quite as much as perhaps you used to. But the good news is you can actually tone up that muscle quite easily by doing some what are called Kegel exercises or pelvic floor muscle exercises.
And you can do those anywhere, can't you?
Absolutely. You know, you don't have to put on any kit or anything.
And nobody knows that you're doing them.
Very discreet as well. All you need to do is to clench the muscles in your pelvis. It's a bit like trying to stop yourself going to the loo. And you hold for about 5 seconds and then you let it go. And if you do that 10 times, and do the cycle of 10 3 times a day, you'll soon start to feel those muscles much more. It might be hard to feel them to begin with, but you know, after a while you'll notice the difference.
Now, you shouldn't be doing them while you're on the loo though, should you?
No, you should just let yourself go to the loo because you can give yourself a urine infection if you just hold your urine back. But doing it at other times, even if you're at work, you can sit and do them.
Or on the bus, people say.
On the bus.
The problem is, because nobody knows you're doing them, nobody's giving you a hard time if you don't do them. So only you will know. So you have to drive yourself to do it. Is there anything else that she should be concerned about or check out?
I mean, I think as women get older, particularly after the menopause as well, it can be harder to become aroused, and this may be what she's driving at as well. The Kegel exercises will help with that as well because they increase the blood flow to the genital area. But there are other things. If the husband or the partner is a little bit quick to the chase, I would say hold back and spend a bit more time on foreplay, because sexual stimulation you need a little bit more to get aroused as you get older.
Take that bit longer.
And to lubricate. So take a little longer on foreplay before getting into penetration. There are other things that can help with the feel. Another one is you can get lubricants now which contain warming ingredients which help to increase the sensitivity in the vaginal area.
Catherine, very good advice. Thank you very much indeed. Well, if you have a similar problem, we hope we might have given you some help, but remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.